Good morning, everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning. It is Thursday, June the 3rd, 2021.
It is.
How about that?
How about that?
Yeah.
I love the month of June.
Do you?
Yeah, I love long days.
Okay.
Big
well,
fan
then
of
June
long
has
days.
you covered.
That's the longest days of the year.
It's coming.
Yeah.
That's true.
Yeah.
So I've heard on the calendar. So there you go.
So the calendar has told me.
Yes.
And speaking of calendars, week 64.
There it is. Oh, my heavens.
That means we have been seeing each other consistently.
Yes.
For that long.
You're welcome.
Yeah.
How is my life richer? Let me count the ways.
Yeah, exactly. It's made my life better. I don't know.
I have enjoyed it.
Yeah.
As we look back, I have really enjoyed this. And I think the community, I've been approached by numerous people in the last recent weeks saying how much they've appreciated this program in particular and KSJE in general because of the programming that we do, the information on this program for sure. For a lot of folks who couldn't get it anywhere else. And that was kind of the reasoning behind this whole show, right?
Yeah.
And to do it on the radio for folks who maybe didn't have social media and weren't accessible to Facebook, because a lot of the things that we see, that the governor's updates and things like that, a lot of times are only on Facebook. To be able to talk to some of these guests we've talked about and have it on the radio, accessible to everybody.
Yep, that was the goal.
Yeah, so I think we're doing a good thing.
And thankful for our community leaders, man.
Right?
I mean, obviously, without the guests, we would have nothing.
All the folks who've come on the
Just
show.
have us.
I know, that's very
Yeah.
true. And so we have two more great guests today,
Yes.
as a matter of fact. We're going to be talking to Matt Bieber from the New Mexico Department of Health, an update on the vaccine rollouts, of course, and the percentages across our state and things like that, and the new thing that the state has rolled out, which is the Sweepstakes for the vaccine. So we'll talk about that.
Did you register?
I opted in.
Me too.
Oh, did you?
Yeah.
Okay.
We've both been vaccinated, but you can still opt in if you've been vaccinated, which
Yes.
Matt will talk about.
He will.
Yeah.
He will. And also, Dr. Amber Layton is coming back to talk to us too this week.
Yes, about mental health.
So that's another great guest. So we're looking forward to talking to both of those folks. So, but let's get started.
Let's do it.
Shall we? Week 64.
Here we are.
Here we go. All right, very good. The big news, of course, is the map released yesterday. Look at that. The whole state is turquoise.
This is cause for celebration.
It is.
It is.
This is the least restrictive, color, if you will, right, for businesses to operate under. It also means that this color is locked in, according to the rules that we're all playing by, 4 weeks. And the state has said that by the end of June, they want to get rid of these colors. And so I'm hopeful that that is what's going to happen. This will be the last update, maybe.
Could be.
I mean, there'll be another update in 2 weeks, but since everyone's locked in, it's not going to change.
No.
So
I kind of want to have like a turquoise sheet cake in celebration.
Right.
The state of New Mexico, just all turquoise.
that'd be cool.
It would be cool.
I like that. So I bet someone has made one for sure. But there you go.
they
So
will
the whole state, every county is turquoise, and that that means 75% operation capacity limits, all those different things. Movie theaters, concert venues, everything has been allowed to reopen at a lower capacity, but we are certainly getting there. So that's exciting. I think very, very exciting. In San Juan County, we can see the averages again from May 18th to May 31st. That's where they took these numbers from, right? And so again, we had cases per 100,000. We're still high. That's why I was a little concerned about that. 15.9, and we needed to be 10 or lower, but you only need 2 out of the 3. So that's what saved our bacon.
Yes.
So there you go.
Well said.
Okay. Our positivity rate was 5.52%, has to be lower than 7.5, so we're good there. And then, of course, our vaccination rate above 50%, and, of course, San Juan County, good job, at 58.7. So because of those 2 out of the 3, we get to keep staying in turquoise.
Yeah.
So that's how that worked for us. So anyway, great job, everybody.
Yes,
So,
keep it up.
There you go. Next, we will talk about vaccinations, right? Because here's where we are in the state. And so again, across New Mexico, New Mexican 16 plus with completed vaccination series. So they've gotten both shots if they're getting 2, or the 1 shot of Johnson & Johnson, 56.0%. Percentage of New Mexicans 16 plus with at least one dose at 65.7. And so again, the governor had said we have to get to 60 with both shots by the end of June. So if everybody at that 65.7 goes back for their second dose, we're there.
Yes.
So that's good.
That is good.
And we have, 4 weeks to get this done. So I think we're on track, is what everyone's saying, which is exciting. And then again, we just started giving out vaccines for folks 12 plus, right? The younger folks. And so there's already 30 people of that age group that have gotten both shots or their full series of vaccinations across the state. In San Juan County, here we are. Percentage of residents with at least one shot is at 73.5.
Very good,
So
San Juan
that's
County.
good,
Yes.
right? And the percentage of residents with the vaccination series completed is at 58.7 as of today. Now, the numbers we showed you was from May 31st, so it's up a little bit since then.
Okay.
So there you go. That's why they're a little bit different this morning. But that's good news.
Very
So
good news.
if everybody goes back for their second shot, we'll be at 73.5.
Yes.
Which is what we want.
That's exactly what we want.
So, and even higher.
Higher,
We
yeah. I
can
mean,
get there.
hey, 100
So,
would be awesome.
Yeah.
Yeah.
So speaking of that, how the state is trying to get folks to roll up their sleeves, and if you've been hesitant, as we always say on this program, talk to your healthcare professional if you have any questions about the vaccine.
Yep.
Don't rely on Facebook or Aunt Agnes
Or your
milkman
your own
or whatever.
intuition.
Yeah. Milkman, how old a reference is that?
Yeah.
We just still have
I'm
them?
sorry,
No.
I don't know what that is.
I know. Oh my goodness.
I've only seen them in giant refrigerators.
Yes, right.
There's no men.
In the olden
there.
days, a man would bring you milk.
Yeah.
Apparently.
In a glass bottle?
Yeah.
Was that upstate New York style?
That was, it's really before my time. It's really an
Okay.
ancient reference, but I don't know why I'm using it. But there you go.
Or your milkman?
Yeah.
Okay.
There you go. Don't get medical advice from a milkman. There you go.
Yeah.
Just anything you remember from today's show, please remember that. We have a guest to talk more about vaccines, not a milkman, but a very informed person from the Mexico Department of Health. So let's talk to Matt Bieber.
Let's do it.
Okay. Joining us this morning to talk about the new Vax to the Max Sweepstakes campaign, Matt Bieber is joining us once again for the New Mexico Department of Health. And Matt, welcome back to KSJE. Good to have you here.
Hey, thanks so much. Nice to be with the both of you.
Thank you. I guess let's get started by just talking to us a little bit about this. This is a sweepstakes for folks to, I guess, entice, encourage them to get the vaccine if they have not already. And for folks who have already gotten the vaccine, they're also eligible to take part in this prize potential.
Absolutely, yeah. If you've gotten your shots here in New Mexico, you're eligible. And there's a bunch of different things to be eligible for. There's big cash drawings, $250,000 per region per week for a bunch of different weeks in a row, followed by a big $5 million drawing for one grand prize winner. A bunch of other prizes available along the way, staycations, hunts, other cool things here that just highlight what we have in New Mexico and all the neat opportunities we have to explore it, especially now that we're reopening economically or moving toward that moment. So it's an exciting set of opportunities.
Yeah. I'm excited about the sweepstakes.
Megan's eyes got really big.
Yeah,
when
I
you
was
said
like, I'm
going
sorry.
on a hunt.
What? Going on a hunt? I mean,
It's one of the prizes.
That's not necessarily a prize. I'll take the cash prize. But
Okay.
So a two-part question. One is these are for folks that have not gotten the vaccine yet. In addition to retroactive, people who have can also sign up. And just correct me if I'm wrong there. And then the second part of the question is, how do I sign up?
Yeah, so it's vaxtothemaxnm.org. And you need to sign up there just to make sure that we know you're actually interested in participating. We don't want to give a prize to somebody if for some reason they don't want it. So it's really simple, vaxtothemaxnm.org. Just fill out your name, email, and phone number so we can call you or email you if you've won something. And you said it well. These prizes are by and large available to everybody, so we didn't want to just focus on the folks who haven't been vaccinated yet. We didn't want to implicitly punish the folks who were eager to get vaccinated a couple months ago. So all of those people are eligible. They're all included. All you got to do is sign up. There will be some additional prizes available at vaccination events going forward. We're going to have the lottery. The New Mexico State Lottery is going to bring some of their lottery wheels down around to various events. There'll be some smaller prizes available there, like free lottery tickets. So those are extra incentives for folks to show up at events if they haven't already gotten their shots. But the big prizes that you mentioned that made your eyes light up, those are the ones that are available to absolutely everybody.
Very good. And so with this, Matt, I guess again it just allows folks to opt in to be part of this sweepstakes, right? So that's what you're saying is when you register at that Vax to the Max website, you are opting in to be a part of this event.
Exactly. You got it right.
Got you. And I know there are some cynics, as I'm sure you're surprised to hear, that might say this sounds a little like bribery for folks to get them to take the vaccine as we get closer to maybe folks who need a little more pushing to decide to take the vaccine. What's your response to that?
Well, I'd say it's a really cheap form of investment for our state. First of all, it's not our money; it's the federal government's money. They've explicitly told us that we're allowed to spend it for this purpose. So this isn't coming out of the state's coffers, but what it will do is help us get protected more quickly and then reopen our economy more quickly, which will be good for all of us, and it'll be a really, really good dollars to donuts investment for all of us.
Understood. And I guess it's the lottery folks are also running some of these drawings, right? Are they the ones kind of handling some of these the sweepstakes and these high dollar prizes and things like that? Are you utilizing their expertise?
Absolutely, yeah. The governor's office partnered with the New Mexico State Lottery because they've got tons of experience running exactly these kinds of events and sweepstakes, and so wanted to make sure we did it well, did it right. Gotcha.
And so when do these drawings start, I guess? When can folks start thinking that they may be a winner?
Yeah, so there are, I encourage folks to go to vax2themaxnm.org, and if you click on rules, I'm going there right now. It's got a little table of dates. So it looks like the first drawing will be on Thursday, the drawing itself will be on Friday, June 18th. And that first week, the way this is going to work is we're going to pull 4 different winners, one per region. Each of those winners will win $250,000. Then we'll do another drawing 2 weeks later, another drawing 2 weeks after that, another drawing a week after that, another drawing a week after that. And each of those weeks we'll do $1 million split across the 4 regions. And then finally, in early August, we'll do that one final grand prize drawing for $5 million.
Wow, got you. And those regions are the state health department regions, basically across the state. Isn't that how you've kind of divided it up?
You got it exactly right. Yeah, if you basically divide the map of New Mexico in quarters, that's more or less what the public health regions look like. Albuquerque, Bernalillo County falls in the northwest region, and otherwise it's a pretty straight up division into quarters.
So we're sharing our prizes with Albuquerque, is what you're telling me, Matt. Okay.
Yeah, the truth of the matter is the folks down there in the southwest are, numerically speaking, are just going to have an extraordinarily high chance of winning because there aren't a ton of people down there. And really anybody from any of the regions that enters is going to have a far better chance to win a really meaningful financial prize than you would with, any lottery I can think of.
There's no question that that's true.
Right?
No question. So another question that I have is just an update on vaccination numbers. Where are we at? There's a certain percentage that the state would like to see and that we would all like to see. And so where are we there?
Yep. So we're going to have updated numbers for today really shortly. But as of yesterday, we were at 55.8% of New Mexicans with their full vaccination series completed. That's people 16 years and over. And remember, the goal is to get to 60% of that group with their full vaccination series completed. So we're really about 4 percentage points away from the governor's goal of getting 60% of New Mexicans vaccinated. And then at that point, that triggers what we talked about earlier. That triggers the reopening, the end of the red, yellow, green, turquoise county-based system. And so we're within striking distance now, and we're on track. We've been on track the whole time since the goal was announced. One final caveat to that is that we're not going to stop when we get to 60%. Really, we're setting our sights a little higher now because we're seeing that we've got some momentum. We think with the incentive program, we're going to be able to bring more people into the process. So we're going to aim higher, probably get closer to 70% as a goal. But the red, yellow, green system will graduate from that 2 weeks after hitting the 60% mark.
Makes sense.
Gotcha. And you were telling us, I think before we came on the air this morning, Matt, that that 2 week delay, because that means when folks get their second vaccine, if they're getting the vaccine that takes 2 doses, then they become kind of fully vaccinated after that 2 week kind of period. Isn't that kind of how it works? That's why we're waiting that 2 weeks.
Exactly right. Yep, exactly right. So full vaccination isn't just the second shot. It's a second shot plus 2 weeks. That's straight from the CDC. And that's just what we know about how the vaccines actually work and when people get their full immunization protection. So we want to make sure that our state reopening is tied to that and folks actually have the protection that they think they have. But that'll follow shortly after hitting the 60% goal.
Very good. Well, we are excited to see some light at the end of the tunnel. So I don't care whether it's cash prizes or a hunting trip that gets us there. Doesn't bother me.
You're okay with it either way?
I'm okay with it. I
gotcha.
Whatever works. So before we let you go, Matt, can you tell us one more time how to sign in to participate?
Yeah, so there's 2 important websites here. So if you're interested in making yourself eligible for the sweepstakes and various prizes, vax2themaxnm.org. And again, that's 2, the number 2. So vax2themaxnm.org. Sign yourself up, quick and easy. If you have not yet registered for vaccine itself, go to vaccinenm.org, create a little profile, pick an appointment, and get yourself a shot. And then that's also really quick and easy. So we'd love to see a boost in numbers. And I can tell you that because of this announcement for the sweepstakes, we're actually seeing not only a ton of people sign up for the sweepstakes itself, 24,000 people within the first day as of just the end of the day yesterday. But we're also seeing a boost in our registration numbers for vaccine appointments, which is ultimately the goal here. So it's working. And we knew it would work because it's worked in other states. And that was the reason we adopted it, because other states had had this positive experience with it. We knew it was going to move the needle and ultimately provide more protection for New Mexicans.
God bless America. All right, Matt. Thank you very much for joining us again this week. We always appreciate your time. I know you're an in-demand guy, and we appreciate you talking to us.
Absolutely. I appreciate the interest, and we'll talk to you again soon.
All right. Thank you very much.
Okay, bye-bye.
And that is Matt Bieber from the New Mexico Department of Health joining us this morning here on KSJE.
Yep.
God bless America.
Yeah.
Well, I just think,
we're fond of that comment.
It would be I wish people would get the vaccine just to get the vaccine,
Yes.
but if it takes a sweepstakes to roll up your sleeve, I guess that's what we have.
Yeah.
And whatever it takes, I guess, right? If we want to get out of this and get back to normal, and this is the way to do that for folks who are able to get the vaccine. This is the point I'm trying to make.
It kind of feels like it's for people who never grew up, because like when you were a kid, go to the doctor, get a shot, get a lollipop,
True,
or like
right.
Pizza Hut used to run that reading thing, read a book, get a free mini pizza or whatever.
Right.
And that's for children.
Sure.
So it kind of feels like this is a sweepstakes for people who never grew out of the token economy, so to speak.
Okay. Well, whatever it takes, I mean,
yeah.
I guess.
Whatever, if the state has the money.
Right. Well, they do apparently. And self-reflection, you donate to KSJE at a certain level, we'll send you a T-shirt.
That's true.
So I guess I should just be quiet.
What is that level?
I believe it's $10 a month.
There you go.
See?
Well worth it.
Well worth the T-shirt for $10 a month, for sure. Very true. Very true. All right, moving on. Here's some other events that are coming up. We want to remind you about talking about the vaccine, right? So you can then get your vaccine and sign up for the sweepstakes. There are some events coming up for 12 years and older now, of course, who are eligible at the different events that are happening. Again, we would like to remind you here at San Juan College later today, 11 a.m. to 1 p.m. is the vaccine clinic. To reserve your dose, you can go online to vaccinenm.org. And again, you have to be accompanied by your parent or legal guardian if you are under 18 years of age. But that's happening today here at San Juan College. Again, for our radio audience, for more info, 327-4461 is a phone number that you can call. Vaccinenm.org is the other number that you can, or the website that you can go to. We want to remind you again that next week, we've been talking about this for a couple of weeks now, right? And La Plata community, the Upper La Plata Water Users Association, having their COVID vaccine clinic next Wednesday, June the 9th, from 4 p.m. to 6 p.m. So that's another opportunity for folks in that part of San Juan County to get their vaccine at a convenient location to their home. That is coming up, of course. That's at 1438 Highway 170 in La Plata. And again, you can register and reserve your dose at vaccinenm.org, and that will make sure that they have enough doses for everybody and don't waste any. And that's always important too.
Yeah.
So there you go. about that. And of course, a reminder from the state that the vaccine is free for everybody. They're still doing that, of course. And if you don't have to have insurance. And then again, a reminder, if you're having an event that you want maybe an on-site vaccination setup, the state is offering to do that, on-site vaccination events for organizations, and that's getvaxnm.com if you'd like to request help to do that.
Great.
At one of your big events that are coming up this summer. And then there, of course, is the sweepstakes that we just talked about with Matt. So there is that. The numbers, and then we'll talk to Dr. Layton.
Yep.
All right, here we go. New Mexico yesterday, only, which I think is significant, 92 new cases for the entire state.
Yep.
That's
That is significant.
That's really significant. That's what we like to see, and hopefully that number keeps getting lower. So now we're at 203,222. Only 13 new cases in San Juan County yesterday, so that's lower than we have seen for 15,487. 4 deaths across the state for 4,268. None of those were in San Juan County. And the recoveries up by another 185 to 189,877. So again, all the numbers are pointing in the right direction, which I guess again goes back to that reason why the whole state's in turquoise.
Right.
With these recent numbers. The Navajo Nation numbers we can share with you again. 6 new cases yesterday for a total now of 30,847. No new deaths for the last couple of days on the reservation, so that number remains at 1,322 across the reservation. So that is important to note as well. So 29,483 recoveries across the Navajo Nation as well. We always share with you the watch list that's updated, of course, and so this week we have new rapid responses going to the bridge at Farmington. 3 rapid responses there. Smith's Food and Drug has 2. The Walmart on West Main has 2, and Piedra Vista High School has 2. We mentioned PV last week, right? They were ordered to close, and they show up on the closure list. Again, PV ordered to close down on May 25th, reopening on June the 8th. Of course, school's out, so it was kind of a moot point at that point, but that's what's going on there. And of course, the other 2 from earlier in the year. And here are the Johns Hopkins numbers.
United States confirmed cases are now at 33,308,317. United States confirmed deaths are now at 595,849, and our vaccination doses administered are at 296,703,261. That's a mouthful of a number, and
Yes.
which is a great thing.
Yeah, I'm proud of you. A lot of commas in those
I was
numbers.
saying it's a great thing because that's a lot of vaccinations, but yes, I can
That too.
read numbers, which is always helpful.
Very helpful. And that's why you're here,
Yeah.
among many other reasons.
Thank you.
Audience. But yes, and take a look at those graphs. I mean, I always like to look at that. I'm a visual guy, but I think, again, it's telling where we've been and hopefully where we're going with these trends of these graphs, right? So the daily deaths are in white. We've seen the horrible peak there back around December, I think it was, and the graph is going down, continuing to go down. The daily cases in red, again, we've seen the surges, right? Those waves that we've talked about, low these 64 weeks.
Right.
And, we had another little bump up there just a few weeks ago after the big spike in, I think, end of the year. And again, that's trending down. The cases are trending down. And of course, there's that green line with the vaccines at the bottom of the screen, which is certainly going up, which is where that big,
Which
huge
is
number comes
where
from.
that number comes from.
Right.
Yeah.
So there you go. Should we talk to our next guest?
Let's do it.
All right. Here we go, everybody.
Joining us now is Dr. Amber Layton from ATV Behavioral Health Services. Thanks for calling in.
Yeah, thank you for having me today.
Great to have you on the program, Dr. Layton, and we kind of wanted to visit with you. I think, gosh, it's been almost a year since we talked to you the
June.
last time. Holy
June.
smokes.
Yeah.
But, I think folks are in a little better place these days. At least I hope many folks are, because there's talk of reopening and less restrictions and things along that line. And I think we just wanted to have you talk to us a bit about, what folks should be looking out for, and if they feel still a little apprehensive, that's an okay thing to be experiencing, right?
Absolutely. Definitely, yeah. So I think the biggest thing with no matter whether it's re-entry or vaccinations or any kind of thing that's kind of being pushed by officials is just try to stay safe and flexible. And that's going to be kind of up to each individual, right? Like, I can't tell anybody what they need to be doing to stay safe or flexible, but just really knowing that, you know, everybody can have their own level of comfort and, you know, being able to not hardwire their schedules so much like we used to be, right? We were very tied to our daily routines and systems, and just kind of have a little bit more freedom to kind of go with whatever comes up.
Right, that's good advice. And I've been thinking a lot about habit formation because, I mean, those first 2 months, it was kind of, everybody was kind of in a state of crazy. We didn't know what was going on, far less than we know now about the virus itself and whatever. Our whole lives were upended. And then we just kind of, we got into this normal sort of COVID world and established a lot of interesting habits, I think some of us. And so, you know, I know that a year to form a habit sounds about right to me, but what's it going to be like now that people have to get up and actually go to an office? And do you have any strategies for those types of things?
Right. So, you know, the biggest thing is staying healthy. And so, you know, there was a period of time where, you know, all the restaurants were closed, so we were forced to either cook at home or eat fast food. And now that things are opening back up, I think that we also need to just remember, like, staying healthy, trying to still prepare some of our own foods at home, especially to bring to the office, and setting, you know, a new schedule. So, you know, maybe going to bed a little bit earlier and waking up earlier, kind of like back to school routine before pre-COVID, how we would with our kids, and just making sure that we plan ahead to, you know, kind of take some time to get to bed earlier and maybe wake up a little bit earlier to get ready and organized. And it's interesting because in the beginning, you know, we were all like, what do we do with all this free time? And now I see a lot of people going like, I just want to be free and I don't want to get up and I don't want to conform. And so it's kind of like gone to the other end of the spectrum where now we're, you know, kind of mad that we have to be places at certain times.
Right. Yeah, we were kind of all enjoying some of that flexibility. But I understand that. And I guess the other question, going back to maybe earlier, you know, you know, when I go out to a store and some stores don't have a mask mandate anymore, and I go in, and for me, in some cases, if it's a crowded store, I still feel more comfortable maybe wearing my mask, and that should be okay, right? I mean, I think, as you said, folks, you know, have their own pace for changing what they've been doing, these habits that we've been doing, like wearing a mask everywhere that we've been going for the last year. Is that kind of what you're hearing and seeing as well?
Absolutely. And that, again, that's, you know, you determining what your safety level looks like and being able to be flexible. You know, if a business owner says you have to wear a mask, like, you know, you need to be kind and just, you know, you don't know what's going on in their life or at their home. You know, they may have a person in the office or at home that's very, you know, high risk. And I think we just need to respect that and not make assumptions either. Just because, you know, it says no mask for people fully vaccinated, that doesn't mean they are, and it doesn't mean they're not, right? Like, we can't control if people are being truthful about it, but if you feel nervous or scared or you have high risk conditions, then, you know, you really need to just figure out what that safety level is for you and be flexible with other people. One of the biggest things, you know, I work in a pediatric clinic too, that we've seen is people, there's a lot of studies about blood clots, and one of the ways to not get a blood clot is to stay active. So even if you do contract COVID, you need to stay active, and we know that activity helps with our mental health as well. But also on the opposite end is those who have got it, you know, they say, oh, 2 weeks, you can go back to work. They really need to pace themselves, because one of the major things that happens with COVID is it binds to our heart receptors, and so our stamina and everything takes a digger, and it's really hard for people to get back up to that, whatever normal was for them. And so, again, it goes back to that being flexible, and I think as an individual or a business owner or anybody, an employer, they really need to know that just because they're past the, you know, being contagious and all of that, they still need to take it slow and be flexible and really listen to their bodies. You know, if you're getting winded or really tired and you've slept well, that's your heart telling you, you know, you need to slow down. And so making sure that we allow that long recovery period to happen.
Right, absolutely. And I want to ask a question briefly about substance abuse, because that was a problem. That was the pre-existing issues maybe were augmented, and then people might have developed new bad habits. What should we be looking out for? You know, if my drinking pattern has changed, what am I supposed to be looking out for to let me know whether or not I need to seek some help with that?
Yeah, so definitely, you know, if it's becoming a safety risk factor, you know, if you've had a couple and you want to go back to the gas station because you just need one more, but you shouldn't be driving, right? Like, so that looking at those risky behaviors, as well as, you know, how has it impacted your life? And, you know, are you calling in because you can't get up on time to be to work because you developed this? And there's tons of resources, both here in the community as well as online, support groups that people can go to kind of get that help, and just know that, like, you know, that happens. Like, co-occurring disorders is what we call them, and anxiety, depression, all these things can kind of exhibit or exacerbate a substance use disorder, and there's no shame in it. Like, just get the help that you need. Again, and it's going back to the help that works best for you, right? Like, there's not a crystal ball, there's not a perfect solution. It's just really kind of reaching out and knowing that there are people out there that do specialize this and want to help.
Right. And Dr. Layton, looking ahead to maybe the fall as school starts again, and maybe the kids that had been going back to school face-to-face, or maybe getting a little hesitant about going back to school face-to-face. I mean, this is all something that I know parents have been concerned about. I believe all the school districts are going to have this virtual option if children, students, parents don't feel comfortable sending their child back to a face-to-face learning environment in the fall. Any comments, any help, any suggestions you can give for families who are maybe having to have that conversation about what children feel comfortable doing in the fall?
Right, absolutely. You're going to get tired of me hearing this, but we're going to go back to biology again. And, you know, humans are social creatures, right? We all know people we don't want to be around, but biologically speaking, we're social creatures. And so knowing that even if there is some anxiety about going back to school, like, this social interaction is important and is necessary for these students. And, you know, it's really interesting. Before COVID, you know, I would work with individuals that didn't want to be in the school system. They're like, oh man, life would be so much better if I was homeschooled. And I don't want to really put a number to it, but I would say about 80% of the kids that I'm working with now, or adolescents, or even college students, are like, I don't like homeschool. Like, I want to be back in class. And so it's kind of, you know, changed a lot of perspectives of, like, you know, I might not like being around large groups, but I still need that interaction. And maybe my parent or caregiver is not the best teacher.
True.
I would not be able to teach math, that's for sure.
Oh,
No
yeah.
kidding.
Yeah. Long division, that's where I stopped.
For most families.
Yeah.
Like,
Right.
My teacher doesn't do it that way. And it's like, well, we have the same answer. Well, my teacher said, and it's like, you know, right? Those are just little things that, like, that's minuscule in the big picture.
Yeah.
So definitely just listening to your kids and letting them know, like, yeah, you haven't been around your friends, and it is going to be a little weird, but remind them of all the things they did enjoy, like, especially the kids that are in some sort of organized sport or club. Like, you get to go back to that, and you get to have this outlet. And, you know, with younger kids, it's really looking at not as it as like a negative behavior, but what is the cause of it, right? And when you can look at it from a perspective of not I'm bad, but what's going on, then, you know, you can just be with them and try to figure out, like, what's causing it versus, you know, stop throwing a fit, right? Like, there's a reason why. And so trying to really, it's hard, but look at it from a perspective of, okay, like, something's upsetting you, and what can we do to kind of reduce that so that it's not a continued behavior.
Right. Absolutely. Well, Dr. Amber Layton, thank you so much for coming on and giving of your time. I know your time is limited, and it's just so helpful for us to hear expert opinion and advice on what it's going to be like trying to re-enter the world again.
Yeah, just stay safe and flexible. That's the biggest thing, is just go with the flow.
Good advice. Dr. Layton, thank you so much.
Thank you, guys.
That was Dr. Amber Layton with ATB Behavioral Health Services, another great guest.
Indeed.
We have one more thing to share before we let you guys go, and that is saliva-based testing. And so if you feel that you've been exposed or if you're feeling sick, register online at curative.com or call 1-888-702-9042, and that's at McGee Park. And then, this is just how to enter McGee Park.
Yes.
Okay.
How do you get there?
Yeah, how do you get there? Off of Highway 64. So
Right.
simple test,
Yeah.
much less invasive than what
Remember
we were
that?
experiencing in the beginning. I do
Yeah.
remember that. So again, if you feel like a little sick or you might have been exposed,
Sure.
then go get tested.
Right. And I think that is, kind of what is happening is that COVID is going to be with us for a while, if not ever. And
Endemic.
So I'm
It's going
afraid.
to go from pandemic to endemic.
Right, which
Yeah.
means that we can control it, I guess, right?
Correct. Yeah,
it's
I mean,
not
it means
an
it's like other
uncontrolled
viruses
spread.
that are endemic.
Yeah, like flu.
Yeah.
We get that every year. We get shots for it every year. I
Tuberculosis,
assume we're going to get
that's another one.
boosters or updates to the COVID vaccine probably as we go
Right.
forward.
So.
But anyway, I think it's just something that we need to be living with. But again, what I hear from everybody is we want to get back to living. We want to get back to gathering. We want to get back to concerts, get back to sports, get back to face-to-face school, all those things. And this is how we do that.
Yes.
We move in that direction. So anyway, everybody, we are going to be here next week. But we are talking about that this show may go away at one point
We are winding down
when
here.
there are less things to share with you. I
We
mean,
are
again,
winding
we
down.
started 64 weeks ago, 4 days a week.
We did.
And then we cut
we-
back, and
then
so we
we-
both took a deep breath.
Yeah,
Oy,
yeah.
that was a lot.
Man,
But yeah.
that was like the only person I saw during quarantine for that first chunk was
That's true.
you.
Well, sorry about
So,
that, but yeah.
Yeah.
Well, and there was a lot to share because there was a lot of unknowns and a lot of questions
Crazy
and a lot of
unknowns.
important information
Yeah.
to share. Then, of course, we went to 2 days a week, and then since January, we've been here on Thursdays. And, and so as we are now in turquoise, and if the state does reopen at the end of June, there may not be as much to share, and so we'll keep sharing it on social media and on our website. But we will be back next week, and we'll be back probably the week after. But we're talking about when the last show is going to be, which we
That's
haven't
right.
talked about in 64 weeks. So
That's right.
it's kind of a nice thing. But don't fear, because Megan has something up her sleeve, and as you can see, her sleeves are very long for another show. With she and I'm looking forward to that. So we'll be back in some form. It's not going to be a COVID show, but it will be talking about maybe some other things. So we're excited about that as well. So we just want to let the fans out there know
Stay tuned.
that even though this show is going away, Megan and Scott are not like bad relatives. We are sticking around.
Don't worry.
That's right. Anyway, be safe, everyone. Have a great week. We'll be back with you next